Closing every school in the United States could cost the economy $50 billion a month, according to new analysis led by a professor of epidemiology at NYU. The majority of U.S. states have already taken this step to slow the spread of coronavirus. And local governments are weighing the decision heavily because closing schools has far-reaching economic and social implications. We spoke to one of the authors of this report to find out how they're measuring the impact.
There's a lot of uncertainty about how long school closures would last and also about how much they'd cost. So if you only closed schools for 2 weeks, the median estimate would be $25 billion. Non-trivial, but again, under roughly 0.1% of GDP. The 4 weeks is $50 billion, and it scales more or less linearly with the duration of the school closure. So the benefit of school closure is clear, but it's also important to take account of the potential costs. A lot of parents would miss work to care for their kids, and those people are subtracted from the labor force. One important question is, what's the inequality implication of this? And many of the people who would be affected are lower income workers who can't telecommute and who don't have alternative means to afford health care. It's also true that lower income children often get 2 to 3 of their meals per day in schools and other social services. So it would disproportionately affect lower strata of the economy. One important group that it would affect is healthcare workers themselves. The fact that there are healthcare workers included in that group also suggests that it would degrade the response to the epidemic in the sense that it subtracts healthcare workers just at a time when we need them to deal with this epidemic. So there are benefits of school closures, obviously. It reduces transmissions by preventing contacts. It reduces the peak transmission rate, which is important because the healthcare system needs to cope with that, and it can reduce the overall numbers. Closing national schools would be the result of state and local decisions. The federal government, under normal conditions, does not have the authority to close all the nation's schools. So this would be the result of an accumulation of local actions. It's very hard to say how long you'd need to keep schools closed. There are many uncertainties, one of which is the extent of the infection in the population at large. Because the testing has not been sufficiently aggressive, we don't really know how much disease is really out there. And one issue is simply when you close schools, there are still circulating infections. And if you open schools prematurely, you get a second wave. And this is what we actually saw in the famous 1918 Spanish flu. There were very, very draconian quarantines and other measures. And people thought that the disease was more or less over, and it was more or less over. The tricky thing about epidemics is they can flare up again with only a very few infectives still circulating.